Well, yeah, I've done it on myself for sure. I literally just did a treatment earlier today with a patient who's getting ready to go down to Southern California for a cycle with a physician down there. And she just had a pretty intense meeting before she came in, and we did the treatment that started on the neck. And she says, "Oh my gosh, I can totally feel this working." And she'd never had the laser yet. Like, this was her first time. I didn't even prompt it. She just kind of said, "Oh my gosh, I can already tell I'm relaxing." That's so cool when people say that.
Welcome to Baby or Bust. I'm your host, Dr. Lora, Shahine, and I am tired of infertility and miscarriage being misunderstood, hidden, and full of shame. Welcome to the podcast where we do interviews and in-depth discussions on all things reproductive health. Today, we are learning all about a new and innovative treatment in the world of acupuncture. Acupuncture without needles. It's using infrared laser light therapy to do the benefits of acupuncture, but again, without the needles. And I'm excited to hear about it from our friend and repeat guest, Dr. Lee Hullender Rubin. Thank you to our friends at Seattle Sperm Bank and Braze Runs Productions for sponsoring the show. Please take a moment to give us a 5-star review. It is an incredible way for people to find our show. And I actually read one just the other day. I wanted to share it with you. Thank you, Kim. Thank you, Dr. Shahine, for this podcast. It is so helpful to have real and relatable information when struggling with infertility. The guests have been amazing. I loved the Tara Lipinski episode. Thank you. That was a great episode. I learned a lot from it. It's episode 49. Tara Lipinski, Olympic gold medal figure skater who has recently shared her 5-year journey to have her daughter through her own podcast called Unexpecting. I loved that conversation. I really appreciate this thoughtful and kind review. I am thrilled to have Dr. Lee back on the show today. She's one of our few repeat guests to talk about the latest in her specialty. She is an internationally recognized award-winning doctor of acupuncture and leader in the field of integrative reproductive medicine. As the founder of Rose Finch Health, Dr. Lee blends compassionate care with over 2 decades of clinical experience specializing in fertility, IVF support, pelvic and vulvovaginal pain, and cancer-related support. Lee, I'm so excited to have you back on the show.
Thanks so much, Laura. It's really an honor to be back.
I love that you started saying 2 decades, like in your intro, because me too. How did we get so old, but yet everything stays the same?
We're not old.
No, of course. Of course.
We're doing great.
Well, I'm happy to have you back because anytime I have questions about traditional Chinese medicine, acupuncture, kind of Eastern care, I reach out to either you or one of our best friends, Stephanie Gianarelli, the co-author of the book that I wrote on integrative fertility. And my patients keep asking me about needleless acupuncture or laser acupuncture. And I knew if something was new in the field, I'm going to go to you because you're so full of knowledge. So tell me, what is this needleless acupuncture, this infrared laser acupuncture?
It's really, I got so into this. I'm really fascinated by a therapy that folks can use that don't want to have needles because as I told you last time, I wasn't a big fan of needles when I first started getting acupuncture. I came around, but I want to offer people lots of different options. So this particular therapy is a really great way to make your body have biological changes on the cellular level with just focused light. And it's not really that far-fetched to think about light having an impact on our biology. We learned in middle school, photosynthesis, where light turns into chemical energy. And we also know that sunlight helps your skin create vitamin D. But, sunlight has a limitation. It can burn you, too much of it. And the great thing about laser therapy is that it's using both visible and invisible infrared light, and it's amplified to make this light that is coherent or focused. And these light rays are emitted in precisely in the same line with each other. And you could think of in one of those fabulous hair commercials where everyone's hair is like so perfect and it all moves in one, fell swoop and there are no strays. The light coming from the laser is collimated. It's absolutely connected to one another in the sense of the rays are exactly the same. It's coherent. It's non-ionizing, which means means it's not going to harm the tissues, and it's non-thermal. It's not going to heat them up. So it can safely penetrate the skin, sometimes as deep as 5 inches, and it can stop pain. It can reduce inflammation, it can modulate the inflammatory response, and it can facilitate cellular repair by promoting wound healing and regenerate tissues.
Huh. So when I think about LED and light therapy, I'm imagining like those TikToks where people have like the mask and like the red stuff is coming out. Is that the technology that we're talking about? Like,
no, it's a little different.
Okay.
They're in the same, like under the same umbrella of photobiomodulation therapy, but laser is different from LED or those masks that you're talking about, or light panels like that are used more for cosmetic purposes, but they have different colors of light. It can be blue, yellow, red, purple, but it's incoherent light. It's not focused. So just like, a spotlight would have this nice broad angle of light, so does the LED. It's not collimated, so it's not exactly, you're not going to get the lovely Breck hair where everything moves perfectly in a mane. It's going to be going in lots of chaotic directions, but that's great for that particular type of therapy because it covers a broader surface area, but it doesn't penetrate as deeply as the laser does.
Well, it took me a while, talking with you and talking with Stephanie Gianarelli and a lot of experts in acupuncture field to try to wrap my head around exactly what acupuncture is doing. And I learned a lot about, energy kind of flowing through our body, and that the needles are really trying to direct that energy and help with healing and regenerative powers. That sounds a little woo-woo, but can you explain for anybody that hasn't listened to our last episode a little bit about what acupuncture is doing, and then that's with the needles, and then how this is mimicking that same benefit?
Yeah, we really want to differentiate that, because with needle acupuncture, it's a mechanical stimulation of the body, whereas laser therapy, in contrast, is using light to generate change in the body. So when we think about acupuncture specifically, the things we know based on measurable changes in research in both animals and humans is that you put the needles in the body and it down regulates your nervous system. So you get nice and relaxed, and all your little blood vessels dilate, and you get more blood flow to the ovaries, you get more blood flow to the uterus. It can help release neurotransmitters, which then help tell the brain, the deep brain, to tell the pituitary, to then tell the ovaries to help develop an egg at the right time or ovulate at the right time. And then ultimately, we hope that regulates the cycle and, even further downstream, help you get pregnant. The other thing we know that's the most popular thing about acupuncture is that it releases endogenous opioids, or your own natural painkillers. So what's great about that is you're feeling less stressed. You're not having any pain. It's this beautiful little, we'll call it AcuStoned or something like that. But to compare that to what the laser therapy is doing, it's instead of that mechanical induction of change in the body, again, we're using light, and the light is focusing on all of the little cells that have chromophores in it. And chromophores are parts of the cell that are responsive to light, chromo being light and phore being attached to or responsive to. And so the chromophores are like water, hemoglobin, cytochromes, flavins, and they absorb the laser light and they initiate cellular reactions that facilitate both, again, local and whole body blood flow. They increase ATP within the cells to help them function better.
Okay, and ATP is just the little energy part of the cell.
Yes.
Yeah.
Thank you for that. It's like adenosine triphosphate. That's a fancy name for it. But it's the power to the mitochondria, or the mitochondria use the ATP to then power the cell. And it helps to reduce inflammatory markers and then increase the anti-inflammatory markers. So that's how it's modulating inflammation. It's reducing free radicals. And then it's, again, also calming down the central sympathetic nervous system.
And how long have we been using infrared laser therapy for fertility in particular?
It's not been that long. Like the first studies were coming out of Japan in 2006. And I really want to acknowledge some education that I received from two other providers, Marcy White and Nicole Holman. They have gone through all the data that they could come up. And then of course I go in and I even pick it apart a little bit more because I am a researcher. But the first study that really sort of reported any kind of benefit is a case series of about 24 women that were going through ART, and they reported that they're
assisted reproductive technology. So they were doing IVF?
Yes.
Okay. Got it.
So there was those 24 people in this case series. But I think the splashiest paper that came out was from 2008 or 9 out of New Jersey, where they did a large randomized control trial. They added laser to the day of embryo transfer, and they found a significant increase in the number of people who had higher implantation than the people who didn't do laser. So I think that's kind of where it all really started.
And in that study, what was the control group? Were they getting needle acupuncture or no intervention?
So this is one of those big studies where there were lots of different groups. So they had a laser group, they had a no laser group, or a placebo laser group, I should say. They had an acupuncture group, they had a relaxation group, and then they had a group that just went through IVF with no additional treatments.
Okay. And then the people who had the highest success rate got the laser acupuncture on the day of embryo transfer.
Yeah, so
fascinating.
I know, it's so crazy. I mean, it's not crazy, but it's they also looked at clinical pregnancy rate and live birth rate, but they only powered the study, which means they set it up because they wanted to know, did this have an impact on implantation? But they didn't have enough people to really determine and assess if this was also going to have an impact on pregnancy rates and live birth rates. But what they did see is that while there was statistically significant increases in the implantation rate, they did also see clinically more live births and more clinical pregnancies in the laser group compared to the others, but it just wasn't statistically significant.
Well, something that you taught me a long time ago is that you really get the best benefit from an Eastern approach to fertility care if you are thinking about the whole person. You're thinking about nutrition and sleep and, plus or minus herbs, plus the acupuncture, and that just to do acupuncture on the day of your embryo transfer is not really getting the best benefit of Eastern medicine. So I just want to point out that this is one study and it saw this great benefit, but were they able to repeat it? And did they, these people who are looking at also all these other great things that they're doing?
Yeah, I would have loved to. This is one thing I wanted to make sure I said to you is that, it's really expensive to run trials. It costs a lot of money. It takes a lot of time, but there has not been any other large randomized control trials looking at laser as a therapy or alongside acupuncture or in a more comprehensive therapeutic intervention. There's been some observational stuff that was funded by a company that makes the laser. So that's a limitation to this study, but that particular one they reported like a 65% pregnancy rate with people who did their laser therapy. I think that's interesting. I think the quality of the reporting could be better, but the bigger thing that I really wanted to say about the research is that, yes, it's very limited in the number of sessions that it was doing. The observational research, like every other situation, it's more like it's reflecting what we really do, right? Like it's telling us, okay, what's happening if you use a larger dose of therapy and what did we observe? But it has limitations, right? Like you can't control for all the things that can influence the outcomes.
Yeah. But it helps us pay attention and it's very interesting. And the fact that it is a randomized controlled trial, I mean, that's the best, most clean research that you can get. So the fact that it's even been done is wonderful. And we have had and seen benefits from acupuncture for a long time. And one of the biggest limitations from my patients is I don't want to do the needles. Like I'm really scared of it. I have a phobia. And so it opens the door to people getting a benefit that we've seen elsewhere, but in a way that might be more comfortable for people. That's why I'm so excited about it. Even if it's new and we're still learning more, it's certainly not harmful in that one particular study to outcomes. And so I'm still really excited about it, even if it's still relatively new.
I think the great thing about it is this has already been investigated in other areas of medicine, especially in pain, especially in people in the cosmetic side, right? And it's had very little reports of any harms. But for the needle phobic, for the people who are just like, please, no more needles, I just can't take it. And that's totally okay. And I think you really should say that to your acupuncturist when you meet them. And if they do laser, they offer that to you, consider it, try it out, because it's an amazing way to get a treatment where there is no penetration of the skin. We place it on the skin, it releases the light, and then you start to notice, we start on the neck, you're really close to this part of the nerves called the stellate ganglion, and that's sort of like helping the blood flow to the brain and then helping you to relax. So we start with relaxation, then we move to the abdomen over the aorta so that we can help with blood flow there. And then we go down to where the ovaries and the uterus are, and we use the laser over that. And the combination of these particular points are intended to, first of all, help you relax. Second, reduce the inflammation. Third, impact the mitochondria so that hopefully the ovaries will respond to the medications when you get them, or that the uterus responds when it's time for a frozen embryo transfer.
What does it feel like for a patient? So when I go in to get acupuncture, it's a discussion, it's a checkup, it's a really good interaction. And then I lie down and then the needles are placed and then I take a nap for, 20 or 30 minutes and the acupuncturist comes back. Is that similar, or the way you described it make me think that somebody's with you the entire time and like placing? How does it work?
That's a great question. So how I've been doing it in my practice right now is that for the people who can tolerate needles, I will do both regular acupuncture and the laser. For people who can't, we might do transcutaneous electroacupuncture stimulation. And I think we talked about that last time that we met. We're using what looks like a TENS machine, and TENS are these like little electrode pads where you stick it on the skin and it elicits like this very gentle electrical stimulation. And we put that over acupuncture points. And I might do those two things together. And I'm actually seeing some really, which I'm going to tell you about in just a minute, some really incredible outcomes when I put those two together with some nutritional support and focused supplements. But in the clinical session, when I see people, yes, I'm with the patient. We talk a little bit. We kind of get a sense of where are you in your cycle? What's happening? What did you learn today when you had your ultrasound? What are your labs saying now? And how are you feeling? How is this going for you? I want to hear how that is. And then we do the laser therapy. And then I will leave the room and I'll place the LED panel over their abdomen to kind of like reinforce this process of circulation in the lower abdomen. I might also put a little warming lamp over people's feet because people's feet love to be cold. And then I just let them rest for a bit and I'll come back and turn everything off, and then I let them go home. And it's another great way to get a treatment that's more passive, where you don't have to really do anything and get that relaxation that you're hoping to get for.
So what does it look like? I mean, I haven't seen it yet, and I'm imagining other people who have done acupuncture are familiar with what that's like. So they're like, well, does it look like a screwdriver with like a little, beam coming out? Or
yeah, it's not like that.
Like a little pencil.
Right. It's not like the pointer, like when you're in a presentation where someone's pointing at it's not like that. Yeah. It's actually much larger. Kind of looks like a wrench in some respects. Like, okay. Like, let's say this is a nail file. It's about this long and about that wide. And it's a rectangular device with the laser beams coming out of just one end of it. And it's painless. So it doesn't really warm up the skin. It's
amazing.
Because we're using and I know that's the best thing about it. Like the infrared light is non-thermal for sure. Red light can be a little bit warming, but it's not enough to burn you. And we only do it for a very specific dose. And that's been looked at a bit by a lot of the Japanese physicians who were researching this.
Okay. I know what I feel like after I've had acupuncture. You said this earlier and it made me laugh because when Stephanie first said this to me, I was like, what? So AccuStoned, like after acupuncture, I'm so relaxed that I do just feel a little bit, not dizzy, but just kind of like really, really deeply relaxed. So I'm curious, have you done laser acupuncture, and do you feel, if you did you feel differently afterwards, or?
I've done it on myself for sure. I literally just did a treatment earlier today with a patient who's getting ready to go down to Southern California for a cycle with a physician down there. And she she just had a pretty intense meeting before she came in, and we did the treatment that started on the neck, and she says, oh my gosh, I can totally feel this working. And she'd never had the laser yet. Like, this was her first time. I didn't even prompt it. She just kind of said, oh my gosh, I can already tell I'm relaxing. That's so cool when people say that.
So we talked about that really cool study, the first study in Japan that kind of got it on the map in 2006. We talked about the randomized controlled trial, looking at it with improved outcomes with embryo transfer. I'm curious if there's other studies that you'd like to share, any other evidence that's out there, people looking into this.
Yeah, there was one particular study that looked at people with PCOS, and they did laser over 12 weeks. So this is a much larger intervention. And they were looking at measures of PCOS. So like things like free testosterone, luteinizing hormone, or LH. That's the hormone that helps trigger ovulation. And people with PCOS tend to have a higher level of LH. And then that ratio between LH and follicle stimulation hormone can be a little bit big for some patients. Anti-Müllerian hormone, they looked at that. That can be high in people with PCOS. And as well as an important feature, which is insulin resistance. So they look at some measures of that, and they compared it to a control group. And what they found was people had less free testosterone circulating, less LH. The ratio between LH and FSH reduced, and their AMH levels also went down. And what was also really cool for me, because I do know that there is some research on acupuncture, the needle acupuncture, having an impact on insulin resistance and like your glucose uptake, the way your muscles take in sugar into the muscles so that you can metabolize it. In this particular study, the laser did the same thing. It improved insulin resistance compared with the control group. So that was one particular study that I thought was really interesting. It had 25 people. I would love to see it done again, to see if we could learn more about that.
It's really interesting. I did research when I was at UCSF looking at Western medicine ways to track breast cancer progression using Eastern medicine treatments. So I love that idea of trying to use Eastern medicine, but track with something that is tangible, like blood levels that we can see. But also, you said something that I know, if I was still trying to conceive and still doing IVF, that my radar would have gone off. You said that it lowered AMH levels in these PCOS patients. Yes. And if I was a fertility patient, I wouldn't want to do anything that lowered my AMH level. So I know PCOS patients are different, but do you want to clarify that? Because I don't want people to be out there worried.
Right. So we know that if AMH is a little too low, that's not great. And if it's too high, that's also not great. We want it to be, quote, just right. And so one of the ways we can think about laser is helping to sort of basically regulate AMH, bring it back into a normal range. So in people who have polycystic ovarian syndrome, it is common for their AMH to be way too high, which means that the ovaries they're working a little overtime, and you want to bring that number down because it may have an impact on quality. It may not. We're not really sure from what I understand. And Laura, please correct me if I'm wrong. By bringing it down, the idea is, as you bring it closer to a normal range, that perhaps any eggs that are retrieved may be a better quality.
Yeah, I think the way I would explain it to my patients is that AMH is a reflection of the number of eggs that are circulating and kind of in a vault and able to be recruited if you were to do an IVF cycle, kind of what's up for grabs. So if you are doing things like nutrition, sleep, maybe laser acupuncture, exercise to get better communication with your hormones and kind of even out androgens, etc., that is probably going to lower the number of these little resting follicles, these little antral follicles, and that will, in reflection, show a lower AMH. So I would talk about it as like, it's like a reflection, but I mean, every day people ask me like, how can I make my AMH better? How can I make my AMH lower? So I think for someone with PCOS, they really have way too many of these little eggs that are up for grabs, and they're actually wreaking havoc. And it's why that they can't ovulate on a regular basis. And so I would imagine, I need to learn more, but I wouldn't say to a patient, oh, the laser acupuncture is lowering your AMH. It's a reflection of the fact that it's probably helping to balance things on a more broad scale.
Mm-hmm.
Anyway,
Yeah.
I don't know. I would love to think about that more, and I'd love to learn about that more, because I love the idea of, I mean, my patients with PCOS, they just want their body to work.
Yes.
They just want to freaking ovulate so they can have timed intercourse and get pregnant like their girlfriends do. And they're just so frustrated. And, and it's just like, why do I have to come to you for medications and ultrasounds? And like, I just want to be able to try like everyone else. And so if there are ways, like we think about the whole person, nutrition and exercise, and if it could be Eastern medicine or laser, anything to sort of help that regulation happen on a more regular basis so that they could conceive without IVF or all those other things. I mean, that's kind of exciting. I'd love to follow that a little bit more.
Yeah, Laura, I think you're really hitting on something that's really important here, and that I really do think of what we do, regardless of what the therapy is that we choose in our toolbox. And that is about regulating. It's about helping your body to work at its most optimal way so that, the eggs that we do ovulate are beautiful and they are receptive to a sperm and they become embryos and they implant at the right time. Or that, that you have a cycle when you are supposed to have a cycle, or that, that you ovulate at the right time. And so regulation for me and how I think about anti-Müllerian hormone and it changing in people with PCOS, that it becomes in a range that's demonstrating that the ovaries could be working a little bit more efficiently. I think for me, I always think about regulation as being a goal. That's the thing that I want for you if I'm working with you in my clinic or practice.
Yeah. That's why I love staying connected with you, because I do think that we think about things in a different way, but we have the same goal. And, people are always accusing IVF doctors as like, all you want to do is IVF. Like I walk in the door and it's like, you're just going to tell me to do IVF. And in a lot of cases, it's the fastest way to a goal because it's so efficient, but also it's not the only way, or you'll even improve your chances of success with any treatment that I'm able to offer if you can think about the whole person. And that's why I often work in tandem with you and with Stephanie and you got to build your team, because I have to talk about treatment options. I can't spend an hour talking about nutrition, or you just have so many more touch points with patients. Like the fact that if anyone listening, heard and really listened, like you talked about, when someone comes in for laser, we're talking about, and you listed like 10 questions that you're asking, how's the cycle going? What was your lining? What was your follicle count? And I just feel like people get better care if it takes a village.
It does take a village.
Right?
Right.
I love it when you're in my patient's village.
We're always happy to be. And I think the bigger thing is that we have to help people not feel isolated in this process, because it can be very isolating. And that's one thing I really love about you, Laura, that you are always in your work on Instagram and your work here is like you're really trying to help people have resources so they don't feel alone. And I think that's important for everyone.
Oh, thanks. I appreciate that. Thank you. Lee, so any information on men? Does anybody use laser to help with sperm?
Yeah, I think, it's just one half of the process of trying to become a parent. You need to have sperm alongside a high quality egg to make an embryo. So yeah, there's been one small study where they looked at men who had poor sperm concentration. So they didn't have enough numbers. It was below 15 million. And they had poor motility as well. The morphology, that's the shape of the sperm, that wasn't as well investigated, I don't think, in this study. And that happens sometimes in these smaller studies. But they did give them a laser intervention, and it did improve the sperm concentration, the motility compared with no laser. And this was in men who were like around 35 years old or under, and they had started the study with a sperm concentration of less than 15 million.
And do you know how long they gave the laser treatment? Because sperm can take 3-ish months to get from start to finish?
Exactly.
Just
Let me
curious.
get that for you. So it was laser twice a week for 5 weeks. So this was a question that I had. They did look at it at 12 weeks. So they started the intervention, treated them for 5 weeks, and then came back to them at 12 weeks after the start of the study. And they had the significant change in motility and concentration.
That's cool. That's really cool.
That is cool.
We're excited about this and I love it, but I'm also curious, how common is it? Like, does every acupuncturist have a laser? I would imagine not.
No.
Or no? Yeah.
No.
Yeah. So I don't want
expensive.
people to get too excited and then be disappointed
Yeah.
in their acupuncturist that they don't have it. I just wanted to have a realistic understanding of how common it is.
Well, there's certain states that actually won't allow acupuncturists to practice with a laser and others that will. So like Washington State, Oregon.
I had no idea.
I know. It's so interesting as just like, well, we can get into another topic about how practice laws are very different from state to state, but it's a whole nother podcast, I think. But for acupuncturists in Washington and Oregon, we can absolutely use laser. In California, we can't. And I know in Illinois and in, Massachusetts, they can use it as well as Florida. Those are several states that I know of for sure. And I know that a lot of people live in these states, so hopefully they'll be able to access this kind of care. You just want to ask your acupuncturist, hey, can you do this? And if you can't, who can?
Yeah.
Who can help me with this?
Yeah.
I don't use it on everyone, but I do use it on a lot of people, especially people with ovarian response issues or a low ovarian reserve. In fact, this is the thing that's giving me the most like joy in seeing the results because I wasn't expecting this, I didn't expect it to have people go through an IVF. They're doing their embryo banking and we're seeing more euploid 5AA embryos, which, I know that the grading, it's somewhat subjective, but it's still not necessarily predictive of outcomes. That's the way I understand it. And please, Laura, correct me on anything that I have wrong, because I always want to learn about this. But how the way I understand it, though, is that is a pretty high quality embryo, 5AA, and that euploid is also great with PGT testing. So that's been surprising me. People who have been told you should really do donor egg, or maybe you should think about stopping ART, or
So you're describing that people are doing their IVF cycles and they're getting their feedback that they have poor quality embryos or the chromosomes are not balanced, right? That's the PGT testing. And that after they're doing treatment with laser, they're getting better results. Like these embryos are high quality. When you say AA, that just means that it's different parts of the embryo that they're saying, hey, how fragmented are the cells? And A is like the best, not very fragmented, even cells, because they kind of split apart from each other. And then you said euploid, so that means the chromosomes are balanced.
Right.
And so have you seen that in your own practice?
It's all observational. One day, hopefully I'll put them all together and maybe write something up. But, I have a couple of cases I could tell you about if you're interested. But I think it's just gotten my attention. Like is there a there? It kind of seems like there may be. And because I'm a researcher, I'm like, oh, if only I could get some money to do a study.
Well, that's how things change. Like you're saying, like I'm had a couple of cases where I'm seeing these beautiful outcomes. And so then you start to say, well, now we got to do a study. And so we could be at the beginning of something, but why don't you share your, one or both of your cases? Give us a little context.
Let me talk about someone who's a little bit older, someone who is 40 years old, who,
watch it.
Only, only 40 years old, and only has two
spring
follicles
chicken.
On ultrasound. Yes,
okay.
Spring chicken. And I really believed in this person, actually, when I met with them for the first time. They had two follicles on their ultrasound. Like, I met with them just as they were starting their first ovarian stimulation cycle with gonadotropins, and their AMH was like 0.5, which is, it's not terrible. I've seen a lot of people get pregnant with that, and I'm sure you have too. So she started the cycle, went through it. And normally what I say is that, I would love to work with you for a little bit longer, but listen, let's help you with the cycle. Let's see what happens, and then we'll know what to do as we move forward. If it goes well, awesome. If it doesn't, then we know what direction to go. So she got to the retrieval. There were 2 follicles that were retrieved and there were no oocytes. So no eggs were there. And it was devastating, right? Like that was just terrible experience for her and her partner. And so we finally were able to kind of spend some time together where I worked with her for about roughly around 12 weeks because it just worked out to where she could do her next cycle a few months later. And they decided to do mini IVF. We did laser in treatment. We would do it twice a week when she was going through stimulation, once a week when we were between cycles. We did some focused nutritional support. We did some focused supplements, not a ton of them. I don't want to give a ton of things, but like CoQ10 is a really important nutrient that I will add in for people with egg quality issues because there's one particular study that was reported kind of like an offhanded thing that CoQ10 and laser may help support each other. They might work synergistically. So that's one more reason to kind of use those 2 together. In addition to that, I did have her do transcutaneous electroacupuncture stimulation at home a couple of times a week. And she did use one of those LED light panels on her abdomen. So we have people alternate back and forth with, you do the transcutaneous electroacupuncture one day, the next day do the LED panel. It seems like a lot of things to do, but if you do it like an hour before bed, it's super relaxing. Both of them are. And so she was able to do that without feeling like it was too much of a burden. She traveled a lot. It was fine. And when it all said was done, she went through 2 mini IVF cycles, which is where they use lower amounts of medication. And for her, it was Clomid. And so she ended up with 2, again, euploid 5AA embryos in storage. And so she's planning her FET next month. And so now we're preparing her for that. Isn't that the craziest and most awesome thing?
Yes. I'm so hopeful for that person.
Me too.
Oh my gosh.
Me too. Another case, if you want to hear one more, is a younger person under 35, but this person is someone who really has a hard time remembering to eat, has a hard time sort of like kind of focusing on self-care. It's like I work, I focus on my work, I get my work done. And like sleep wasn't great. Nutrition wasn't great, had gone through 1 ovarian stimulation cycle, didn't get any embryos, which was really awful, had several IUIs, wasn't able to get pregnant with those with medications. So when I started to see her, she had started a cycle, got the flu. So she was kind of forced to, they canceled the cycle. So we were forced to have a little more time together. By the time she was able to do a cycle, we were doing laser. We were doing the LED light panel in the office, but not at home. And she was doing transcutaneous electroacupuncture stimulation as well at home. And she ended up, after 2 ovarian stimulation cycles, with about 4 euploid embryos. Of the 4, 3 were 5AA. She had her FET last summer. She's like now 39 weeks pregnant. She's like ready to, I just saw her this past week. She's doing really, really great. But at the very beginning of the process, she was like super anxious. Like, I just don't think I can do this. This is really hard for me. I can't remember to eat. I can't remember to do all these things. I feels like it's so much to do. And so I kept that in my mind. I'm like, okay, I'm not going to give her a ton of things to do because I think it'll be too much. But let's just help you remember to eat. And then I added in, okay, now let's see if we can help you sleep. The transcutaneous electroacupuncture stimulation 1 hour before bed is chef's kiss. So good for helping people sleep.
That's awesome.
And we know sleep is really important for fertility, right?
Very
you need
important.
Sleep.
Absolutely.
Yeah. So she's like, I'm just so thrilled for her. She's just doing great.
That's awesome. What is this transcutaneous at home acupuncture? How does that work? Is that like you buy it on Amazon?
You could do.
Okay.
I think we talked about it last time when we met, but it's basically a TENS machine.
Yeah.
Again, where you put it on the acupuncture points.
Yeah.
And I just basically coach people on how to do it, when to do it, because there are certain situations where you don't want to do it.
Okay.
And there's certain cases, so you kind of have to do an assessment to make sure it's right for you. And so there's some much better data on the transcutaneous electroacupuncture stimulation to improve lots of different measures associated with fertility and improve IVF outcomes.
I mean, is it like little stickers that go on your body, or how does that?
It's the electrodes.
Wow. Yeah, that's fascinating. I do worry about access to care, a lot.
Yes,
like
me too.
I kind of have been saying a lot on Instagram. It's like fertility doesn't discriminate, but access to care certainly does. And just like,
Amen.
Somebody in Florida, it's not going to be easy to come see you in Oregon or, and that person that works a lot and travels a lot, like they might be able to come see you and get a lot of coaching, but to be able to do something like that at home, that's really very encouraging. Because also when I'm talking to people about building your village, your registered dietitian, your therapist, your acupuncturist, and, people are like, I just don't have time to do all of these things. I think that's a pretty exciting thing to think about too.
Fully agree.
Yeah. Okay, Lee. So this has been so fun learning about something new. And I feel like it's definitely, there are studies there. It is so exciting to think about a new option. But could you just kind of summarize a little bit where you think laser acupuncture is now and kind of where you think it might go if in the future it continues to be more and more popular?
I think we're going to see bigger interventions, so meaning more treatments that are assessed in a more regulated or rigid environment for a randomized control trial. And we're going to see if it improves people either just trying to conceive on their own or going through IVF. And if I had my druthers, I would really love to see it in people who are banking embryos or just even banking eggs. And then I would also like to see it separately in people who are doing frozen embryo transfers, because these are different types of cycles. And, your body's doing different things for each of these types of cycles. Yeah. And I'm also very interested to see if we'll see more for our fellas or people with sperm who are having challenges with having enough count or motility issues and the like. Yeah,
absolutely. Yeah, can't forget about the men. It's half of the genetic equation.
No.
It's very important.
100%.
Oh, I love talking to you, Lee. How can we find you? How can we connect with you and learn more from you?
Yeah, so I am on Instagram. I'm at Rosefinch Health. That's my practice Instagram. You can also find me online at my website, rosefinchhealth.com. I think those are two good places to find me.
And all the research that you've done, you just go to PubMed and look up Lee Hullender Rubin and you get overwhelmed. Well, that's one thing that, people are like, oh, acupuncture, whatever. It's just woo-woo. And I'm like, no, there are some really smart people doing some pretty amazing research. And my friend Lee is one of them.
Thanks, Laura. I really appreciate that. I think what's great, though, is there's a lot of people having to wait to get in to see their fertility doctor because the wait lists are getting so long. This is a good time to prepare. And this is where we as the acupuncturists can kind of come in, help, improve nutrition, help you sleep, help your cycles get a little better. When you get to the fertility clinic, you're ready to go. You won't have any delays, hopefully.
I love it. Thank you again, Lee. Really good to talk to you.
You're welcome. Thanks so much. Have a great day.
I hope you enjoyed this discussion as much as I did. I love learning about innovations in all fields and areas of reproductive health, but especially in something with acupuncture. A lot of my patients are interested in acupuncture, but they're really nervous about the needle. So having a laser light therapy have similar benefits and outcomes is something to follow very closely. You can find this episode and all others on my website, drlorashahine.com. Other resources there are links to my Instagram, links to the books that I've written, links to my YouTube channel. I really hope that you can find the information that you're looking for there. If you have ideas on topics you'd like us to cover, people you'd like us to interview, please send us an email at hello@drlorashahine.com. Thank you to my producer, Shannon Perry, and the team at Audiotocracy. This is your host, Dr. Lora Shahine, and as always, wishing you love, luck, and pineapples.